comes a time when we heed a certain call, when the world must come together as one.
There are people dying.
Oh, and it's time to lend a hand.
Limited recognition. And that causes lack of prioritization of nutrition care, which is leading to insufficient funding and resources allocated to address this pressing issue. Now, this can lead, as you all know, to substantial healthcare costs and strain on the healthcare system. So what am I saying here? What I'm saying is we have implications of hospital malnutrition. We have clinical implication. We also have the economic implication. A malnourished patient in the hospital costs us more money to take care of. They stay in the hospital longer. They have complications. For example, if they had a surgical procedure done and they are malnourished, most likely their wound will not heal the way a well-nourished patient will. So, and I don't know if some of you who practice in the hospital, studies have shown that a malnourished patient who is in the ICU on the ventilator, it's difficult to wean that patient from the vent. So what does all this do? That increases the stay of that patient in the ICU, which is all leading to increased cost. Next slide. What are some of the other gaps? Because of lack of awareness, of lack of appreciation for hospital malnutrition, we have lack of standardized protocols. And one of the protocols that we probably need to talk about is number one, how do you identify these patients when they come into the hospital? If we have standardized protocols that emphasizes nutrition screening and assessment, that will help us identify these patients quicker. So the absence of comprehensive national adopted guidelines for nutrition screening and assessment, interventions and monitoring, that obviously can lead to less effective care plans and also create some kind of fragmented approach to nutrition care. So lack of standardized protocols focusing on nutrition screening and assessment. Now, in terms of the standardized protocols, we also need to have protocols for post-discharge care. We need to have a continuity when a patient is in the hospital and we have adequately given them the nutrition care. When they are discharged, we need to have a structured post-discharge nutrition care plan. But that's one of the gaps we have. So there's limited structured systems for post-discharge nutrition care, which can increase the risk of readmission. So when you send a malnourished patient home to the outpatient setting, most likely that patient is going to be readmitted to the hospital. All these are all adding to the healthcare cost. So patients or their caregiver, because they don't have that information from the hospital, cannot give the adequate nutrition care to the patient at home. And again, this leads to patients' nutritional status declining.
Data is key, and we need to think a national situation. So we need to have a burden of malnutrition in our hospitals. What was the summary of what at this conference we were able to inaugurate? The management of LUTH inaugurated a multidisciplinary team of healthcare workers in LUTH called the LUTH Nutrition Steering Committee, which was inaugurated with definitive times of reference. And subsequently, the team has come together, and we have elected among ourselves officers to serve in different capacities. I was privileged to be the chairman of that committee. We have the vice chair, we have the secretary, and then the assistant secretary, and then the treasurer. And we decided to have more in July, in August, and in this month of September. And of course, we establish subcommittees within ourselves with leaders, and those committees are as outlined. We have a committee for policy development and guideline. We also have a committee for research, which is essentially that we are in this week, and we also have a committee for quality assurance and total parenteral nutrition formulation. All these committees were formed, and we have leadership of it, and they have commenced work in earnest. So I'll give us a prologue of the activities that the Education and Research Training Committee spearheaded us in achieving in this 1 week and this week-long activity of the Malnutrition Awareness Week. And so an insight into what transpired. Monday, we could not do any activity because of the public holiday, but Tuesday, we had the public awareness work with campaign, both to the community within the hospital and outside the hospital, for sensitization on in-hospital malnutrition. Also, we had nutritional assessment in our pediatric outpatient clinic. After giving them a talk, and we have some now we also initiated a loot staff step count competition because we want people to have healthy lifestyle. So we had apps that people are engaged, and then we could the highest step for that day will be rewarded at the end. Day two, we had public awareness to Loot Primary Healthcare Center, which is the annex of the hospital in Ogun State, facto in Ogun State, and as in additional status assessment at our adult outpatient clinic this morning. And also we also give them talks apart from the assessment, and also dovetailing into the webinar of today. And tomorrow will be our grand finale, where we have presentation of gifts for the people that have the highest count from the first day activity. So this is the synopsis of what has transpired within the week as regards to this unit, this committee's development. Now,
we were actually looking at social determinants of health, looking at nutrition holistically, because when you talk about malnutrition, there will be nutrition to have the malnutrition, whether it's under or lack of access to food or having more than enough. So we looked at the social determinants of health. We looked at all the environmental factors that will impact, health outcomes. Primarily, we looked at the policy gaps, that can have direct impact on nutrition and, of course, on nutritional outcomes. The very first we looked at was girl-child education. We are looking at then when you educate these girls from primary school to secondary school about proper nutrition, adequate nutrition, on the gaps, nutritional gaps, that they will take the message home. By the time they get married, the same knowledge will continue increasing, and they start having children. What they learned, while they are in their homes, their parents' homes, will be useful to them, while they get to have their own children. So also looking at adherence to nutritional guidelines. When this girl child is actually adhering to guidelines on nutrition, it will curb malnutrition. Second thing that the committee looked at was, we looked at the development initiatives. We are thinking that paying advocacy to the key stakeholders, critical stakeholders, and having access to programs, going to the political bigwigs and people who matter in the society, traditional rulers, that when we engage them meaningfully and let them know that some things we do in the communities are not going to go well, as per having an adequate nutrition for people, especially maybe women who are not privileged, the indigent, and all of that. So we looked at development initiatives that will help especially women who are indigent. We also looked at food insecurity. We were looking at what can we do to if not to improve on food security, we are looking at all of the agricultural initiatives that we can bring on board to ensure that people go back to farming. Because when you farm, you say you do organic feeding, you know the things that you eat, what you put in your mouth. We also looked at income and social protection, the policies around income and how can people better their livelihood, what can they do so they can put food on their table. And what are the things that we think when we do, we'll have a stable economy in the families, looking at how the country is going. Some people, they don't have good paid jobs, some don't have job security, some go to work and they are downsizing, and all of a sudden the person loses job. We also looked at the political unrest, all of the inflation, violence, insecurity, all of the things that happen around when we have political unrest. Then we looked at emergency preparedness, and then how do we respond when we have natural disaster. Some of our areas that are in the hard to reach areas, when there's flood, we're expecting flood anytime from now. When they leave where they are to other places, what happens to their farmland? What happens to all the things that they have been doing in the months and all of that? So we started looking at those, and then the consequences when we have flood and epidemics, all of that, in the area. We talked about cultures and then social norms. A lot of our people believe that women don't eat gizzard, some things that we do that affect nutrition. So we looked at them and the impact they have. Some of our feeding habits, some of our men feel they must be eating some staple foods, you must be fufu, fufu, fufu. Even when you tell them you have diabetes, you don't have to cut down your carbohydrate. So we're looking at all of those culture and the social norms, we're looking at the food we consume at this particular area, whether they do good or they do harm, looking at how these foods are actually prepared. All of that the committee looked into, and finally, when we look at the political and instability.
Concerning the Malnutrition Week, the Ahmadu Bello University Teaching Hospital has been preparing for over weeks now, and we've actually addressed all the daily programs as outlined for the week. The Nutrition Steering Committee has met and prepared for this week, and we assign roles and responsibility to all the various members that were quite active during the week. Monday, the first day, was actually a public holiday, but we were able to air a radio interview with one of our pharmacists who discussed about the week and the intent for the week through the Ahmadu Bello University media. The second day, as Tuesday, members of the committee did a public awareness throughout the hospital, at the clinics and the wards. They move around with banners and handbills which were shared to patients and staff during the awareness presentations. Yesterday, Wednesday, we had nutrition assessment at two clinics, one at the pediatric clinic and one at the medical outpatient department, where two separate teams made health talks at the clinics, demonstrated nutritional foods, and also served Tom Brown, which we quite know that is very nutritional.
This meeting is being recorded.
Prepared by our nutrition unit. I myself was at the MOPD clinic, where quite a number of my patients were answered by members of the nutrition department that were at that post. Today, Thursday, we had a community outreach at Milgoma, which is just nearby to the hospital. Our team were there, comprising of doctors, nurses, pharmacists, nutritionists, community health workers. among others, including our intern house officers we incorporated from all the departments of the hospital. There they made health talks to the community, where the members of the community, including women and children, came en masse to listen to the health talk that was given on malnutrition. The team also demonstrated to them how to prepare ORS in order to address, to educate the mothers on how to quickly attack any diarrheal disease which can either predispose or compound malnutrition in the children, the community. They also shared sachet of already prepared Tom Brown to about 150, I think, sachet of 1 kg of Tom Brown was shared. And the mothers were also taught how to prepare that Tom Brown on site, and samples were given to the children to test right there. They also shared some medication, including zinc.
This meeting is being recorded.
And the children were dewormed as well. By and large, all the events for the past 4 days have been successful, and we are already preparing. Today we are holding this meeting. Quite a number of the members are here with me within the boardroom, listening to all the presentations. We have also planned for the grand finale tomorrow, where we have 3 sets of presentations that are going to be presented to the members of the hospital committee. We have reached out to some companies who are ready to be present and contribute in the meeting. Among the people who also reached out to the Commissioner for Health for Kaduna State, who, though engaged at present this week, has agreed to send a representative, the medical director of Kaduna State of Barotiko Teaching Hospital.
As far as NGT is concerned, nutrition activity is at infantry stage. However, we have a lot of committed dietitians and nutritionists who have kicked into all the programs of the week. Management gave a lot of support, and we have participated in all activities. There are banners were prepared, posted, awareness campaigns are carried out in outpatient and even inpatient wards. Outpatient clinics and inpatient wards. We also printed t-shirts to mark a week. We have a lot of gaps. As far as nutrition is concerned, in NGT, there is work in progress. However, we have a committee at the state level, Bayelsa State level. Bayelsa State Committee on Food and Nutrition. Over time, this committee has been reaching out to schools through the State Ministry of Education, enlightening various schools on the need to have proper nutrition. Also, brown use nutrition is already been given to various health facilities in the state, including the Nigeria Delta University Hospital, and it has aided us in handling malnutrition, especially among the pediatric age group. The state government has a robust health policy, Bayelsa Health Insurance Scheme. As a hospital, we will advocate that nutritional preparation, especially enteral and enteral nutritional preparation, should also be covered by the Bayelsa Health Insurance Scheme. because of the level of poverty among the people. So a lot of people are less privileged in the low socioeconomic group. So when you present in the hospital, and when you have to have internal feeding, you need to procure the products is always an issue. Our own experience this year. So we make all efforts to ensure that those the scheme also cover those aspects of care. We are not limited to those activities in the hospital. We are planning to have a robust engagement in the community, because there are a lot of cultural practices that also affect nutrition, like the way foods are prepared. So it's good to, there is a way foods are prepared by some ethnic groups that will not allow micronutrients to actually have good impact on our nutrition activity. So those issues will be addressed through sensitization. We also want to advocate to involve the oil companies operating in various areas of the state. There are a lot of activities there with attendant pollution of the environment, marine life, and also on the land, affecting agricultural produce, especially seafood. Before this period, our people could just go to the swamp and get marine food, seafoods, to eat without much issue. With this pollution, a lot of the marine life have been lost. So their source of having cheap protein food is affected. So there is need to do a cleanup of the environment so as to restore our ecosystem, to enhance food production and also fishing activities. Because most of the people are fishermen and fisherwomen. We also want a situation where we have the political will to provide the necessary facility so that our nutritional department and activities be more robust and all embracing. We are keen into it. This is demonstrated by the fact that we sent some of our staff even Western training to acquire skills. We really need to do more training, especially when it comes to internal and parental nutrition. Most of the economic challenges that face in the country also affect our state, with the result that a lot of hardship among people that are affecting the ability of the people to have very good nutrition. So we really need good collaboration with the NGOs, also with developmental partners on the needs to fund just programs to alleviate the suffering of the people. Another group that we want to call on is also civil society organization to put pressure on government to influence activities that will enhance good nutritional activities in the state, and also enhance the ability of the people to have very good nutrition. We are looking at several options on how to develop more robust nutritional activity. One is the facility. How we are going to expand the facility of the Niger Delta University. Also, we are taking a look at how we can make provisions to ensure that most of the gaps that we have are bridged. So activities in Niger Delta University, as far as nutrition is concerned, is work.
For the program, we started with the media awareness campaign, which is on the 16th. Even though it was a public holiday, we used the opportunity to go to the media. We had a talk with the NTA here in Jalingo, where we talk about malnutrition, what are the causes of malnutrition, and where we are now, and what can be done to eliminate malnutrition. We also speak with the Taraba State Television. We also have the Frontline TV. Then we have the Taraba News. All these are media houses that decide to collaborate with us to see that this campaign and the awareness week is achieved. On the 17th, which is on Tuesday, we now took the campaign to community level and also at the specialist hospital. We visited Jorovoto, which is a community within Jalingo. We went there because we discovered that our indices, based on the patients we always receive in the hospital, mostly comes from Jorovoto and other community. But we visited Jorovoto that Tuesday, where we had a sensitization. We talk about nutrition education. We talk to them on what proper nutrition. It's all about the consequences of not getting the right nutrients. We also did what it's called food demonstration. Our emphasis was more on food diversification and also home gardening, where we talk to the women to do more of backyard gardening, and we also encourage them to start something small so that they should not be idle, where they can also support their husbands. We also did nutrition assessments, where we assess most of the children in that community. But one of the challenges we had there was because some of the community people there refused to come out because, according to them, they are tired of people coming for assessments, giving drugs, and whatever. What they want to see is food. They don't want to hear anything. So that was one of the challenges we had, but we were able to talk to the few, and we had the support of the heads of most of the heads in that community, because they have different head words, about 14 of them. We had an opportunity to speak with them, and even the Christian community that were within that environment with the Muslim community. So from there, we now went to the Taraba State Specialist Hospital, where we saw the CMD in person of Dr. Alex Miangwa. He gave us an open arm and gave us his support. So we went to the maternity because that day was immunization clinic. So we spoke to the mothers. We also do food demonstration and best way of preserving nutrients while cooking, in order not to destroy the nutrient content of that food.
I want to thank the organizers of this conference, especially my good friend, Dr. Pounds. I can see her passion and also translating, something we discussed on the sidelines of a cardiac mission to a social action. So I think it's a very good initiative. But one key thing that I noticed kept coming up, which I hope at the end of the day we'll be able to either identify and probably map out a plan for the future, is how we can have collaborative action in addressing this hospital-based malnutrition. Because from what she presented and also what the other speaker started presenting with.
For me, as a nutritionist or as a nutrition expert, a pharmacist and a nutrition expert, I want to draw our attention to the need to drive this. Let's not feel discouraged. Usually, the commencement of such feat usually can come with a lot of need for sacrifices and others. We are desirous of a better pedestal to trade on with time if we make meaningful sacrifices. We are hopeful that Plateau State will do well to key into this in different governance levels, and we solicit for your support and your prayers through this. And thank you so much. Just know that you have our support from this end, and we'll do our best to ensure that we sustain this ongoing. You have my best regards.
I also want to thank all the participants, all our panelists that actually opened our eyes to all the wonderful things they're doing in their institution. Really kudos to everybody. Just like I'm listening here, a lot of people are very enthusiastic about what we're doing about malnutrition and want to share what they're doing. Unfortunately, like Prof said, the time is, we have to close because it's 1.5 hours, we're limited. But I want to let everybody know that this is not going to be the end for WASPEN. We are going to be calling on a lot of the people here. We will look at different initiatives to come to you so that we can see what we can do collaboration-wise to move your ideas and bring it to reality. I just cannot express how pleased I am with the kind of support and the kind of passion that I'm seeing and I've seen from every one of you. So I want to just close again by saying thank you, keep it going, don't give up. By the next time we meet, we're going to be telling a different story. We're not just the group of people we have here, we're just not the people that talk. I can see we are action people. We believe in making things happen. So thank you. And I'll continue the good work, and God bless us all.
To life, the greatest gift of all.